We're excited to be here, Scott and myself, to focus today is on integrating mindfulness in clinical practice. This project is funded through a federal grant through HRSA, and so we're excited to be here today, and Scott is going to share his expertise with you in relationship to mindfulness.
Thank you, Aidan. Well, welcome everybody. My name's Scott Fairweather. I'm a clinical instructor up here at the university. Prior to joining the university, my background is very much in private practice as a DBT clinician, where there is a pretty significant chunk of what we do is related to mindfulness. So I'd like to talk a little bit more broadly about what mindfulness is for people. So today, our hope is to define what mindfulness is, discuss how mindfulness is helpful to both practitioners and clients in clinical settings. And throughout the presentation, we're going to apply mindfulness practices that can be either utilized by practitioners or that you might utilize with your clients and apply them to case scenarios. To begin, I'd love to use the chat. If people feel like unmuting and speaking, I would love that even more. But otherwise, I'd love to hear what your thoughts and what your understanding of mindfulness is. I think everybody has some different ideas. But when you hear the term mindfulness, what comes to mind? Being present. Oh, here we go. Sensory, being in your body. Love it. Focus, calm. Being in the present, here and now. Meditation. Awareness of the moment, fabulous. Serene, positive work, being aware in the moment. Grounding, being present, awareness. Breathing. Yeah. I think if you take a lot of those statements together, we take a lot of these together, we come up with a very close idea of what the definition of mindfulness would be. But mindfulness is a state of consciousness that has to do with attending to one's moment-to-moment experience. So it has to do with being in the moment, right? And I think I saw meditation show up, and sometimes, people think of mindfulness and they think of meditation as one in one. I think meditation helps with becoming more mindful. If I've got to kind of think about this as a metaphor, I think of meditation as almost like the workout and mindfulness as the being in shape. And so the workout is what helps with the being in shape. And so many times meditation or forms of meditation, which we'll talk a little bit about, help with this, help us build the muscles necessary to be mindful in our daily lives. So with that in mind, I'd like to start off, but I would like to go ahead and start off with a mindfulness activity. It's an activity that I've used in the past, but it's called Mindfulness of Threes. And so what you can start off with is, find yourself a posture. If you're sitting, sit with your feet flat on the floor, your back straight, but not in a position that would be painful. You may want to have your hands open. We just don't want to have them clenched up in fists, but you could have them sitting on your lap or in your lap, either up or down. And then your chin slightly tilted up and your eyes open. So part of this is, again, it's about being present, and we're human beings. We rely on our vision as much as anything. I will ring the bell 3 times, my mindfulness bell here, to go ahead and signal the beginning of the mindfulness activity. I don't want you to change your breathing. I don't want you to try and do deep breathing, to relax. That's not the goal of mindfulness. We'll talk a little bit more about that in a minute here, but I want you to follow your breath. I want you to notice the path of air as it goes into your mouth or into your nose, down your throat, and into your chest or diaphragm. So I'll ring the bell 3 times to begin. I will then ring the bell once again. And as you're attending to your breath, I want you to kind of open up your sensations to the feeling of your feet on the floor. Notice the sensations of the bottom of your feet while you continue to follow your breath. I'll then ring the bell again. And I want you to add to the breath and the feeling of your feet, your awareness of the sounds that you hear around you, in your room or around you. Inevitably, during this process, you're going to notice that you're either attending only to one sensation or you're attending to no sensations because you might get distracted or you might start noticing you're thinking about something. When you notice that, I would like for you to try and come back. And so many times people find it easier to just start again with the breath and then add in the feet and then come back to the sounds in the room. So we'll do this for a little while, and then I'd love to hear what people's experiences are. So this is the mindfulness bell. We'll go ahead and get started. I'll ring it 3 times to start, and then each time I ring it, I will add in the new sensation I want you to pay attention to. So first, you're going to follow your breath. Don't change it. You're just going to breathe as normal. So again, follow your breath. Focus on your breathing. Don't change your breathing. Notice the air where you notice it. For some, that might be in your nostrils. For some, that might be your chest or your diaphragm. Just focus on your breathing. When you notice your attention drift, bring it back to your breath. Now, incorporate bringing your attention not only to your breath, but also to the bottoms of your feet as they sit on the floor. Continue to follow your breath and increase your awareness of your feet. If you notice your attention drift, bring it back to your breath and the feeling of your feet on the floor. Now bring your attention to your breath, feet, and the sounds in the room. Don't think about the sounds. Don't label the sounds. Just sort of notice the sounds and let them flit across your awareness. If you notice you're only attending to one sensation, come back to your breath. So as we wrap this up, I'd love to hear through chat or again, if you'd like to unmute, you're feeling brave and you want to speak. What did you notice about that experience? Difficult not to change it, hard to stay focused, challenging to be yeah, all 3. Yes, it takes practice. distractions, but you came back to it. More at ease. Difficult not to label sounds, absolutely. When you were focused on your breath, it was difficult to pay attention to other things, absolutely. Not used to being so still, yeah. Felt more calm. That does happen sometimes. Sometimes it doesn't. As we've seen, some people found it difficult, and that's okay. Notice the weight of stress, silence. Trying to just focus was difficult, sure. Sounds that you had never noticed before. Yeah, I think a lot of these are very consistent with our definition of mindfulness, which is an awareness that emerges through paying attention on purpose in the present notice. Because sometimes mindfulness is not about relaxation. Mindfulness is about an awareness, a purposeful attention in the present moment, non-judgmentally, to the unfolding of the experience moment by moment. It's a definition of mindfulness by Jon Kabat-Zinn. Jon Kabat-Zinn, if you know who he is kind of the founder and developer of MBSR, which is mindfulness-based stress reduction, that was developed in 1979 at the University of Massachusetts. MBSR initially was developed as a pilot program to help patients that were struggling with chronic pain and stress. So as we move forward in today's presentation, we're going to be kind of using this definition of mindfulness, this idea of intentional awareness, that you're paying attention in the present moment. So you might notice painful feet that you hadn't noticed before, and you're not there to judge it. So again, it's an intentional awareness of one's present experience. It's a way of connecting with yourself. A practice. We're going to talk a little bit about the difference between formal practice and informal practice. I think very importantly, it's not goal-directed. We're not here for relaxation. Mindfulness is about connecting with your experience. At times, people may find mindfulness to be relaxing, meditation and other things. But that is not the goal of mindfulness. The goal of mindfulness is to be present in one's life and to experience one's thoughts and emotions, physical sensations, a way of connecting with our core being, which I think, especially in our Western world, we are very, very distracted from. We have so many different things going on. Our focus is on goals and where we got to go next and what we need to be doing next, as opposed to just being present with our current experience. So again, big keys are an intentional awareness, being non-judgmental, not rejecting a moment, not clinging to a moment, not trying to push a moment away. There's really about 9 different attitudes of mindfulness that Jon Kabat-Zinn talks about. We've talked a little bit about the non-judging, but there's these other ideas. So I'm going to kind of define generally what the idea here is. And my hope is that you'll be able to bring some of these in for you, for your own life. So non-judging is learning to pay attention on purpose to the present moment without judging it. You know, we all have thoughts and ideas, our own opinions about the things we encounter. And I think what's difficult about this is that the more of an expert that we become in our world, the better nurse you become, the better pharmacist you become, the better social worker you become, the more we limit our thoughts and ideas of possibilities, because our world actually kind of gets smaller as we become more expertise. So mindfulness is an awareness of our judgments. It's not getting rid of judgment, because you can't do that, but it's an awareness of judgment, and it's not judging your judgments. When we take our judgments, our thoughts, our opinions about ourselves and our world, they can become toxic. They can become a habit of our mind, and they can blind us to what's going on in life. So by practicing non-judgment, we're learning to discern what is from what we want or don't want, what we like and don't like. When we treat our judgments as if they are reality, we can experience really strong emotions. When you worry about the future and you're treating, I don't want this to happen, we tend to get more anxious. When we tend to treat our judgments about ourselves as if they're reality, we tend to experience a lot more shame. If we tend to look at our judgments about the past, we can have a lot more frustration or sadness. So this idea of not judging our experience, this idea of patience, right? We live in a fast-paced society. Everybody is on here because they're professionals. They've been working hard in order to get to where they are. So many times we're impatient in the moment, and so we can get on to the next moment. So this idea of patience in mindfulness is allowing things to unfold in their own time. A book that I was reading many years ago about mindfulness talks about the difference between washing dishes so that you can get done with the dishes so you can move on to the next thing. So if you want to, if I'm thinking about my own life, it's washing the dishes so I can get my son and go to the park, as opposed to being present in the moment and washing dishes and just noticing the experience of washing dishes. And the problem with this is that if we're just always living in a world where we're washing the dishes so we can get to the park with our son, then when I'm at the park with my son, then I'm at the park with my son and waiting to get on to bed, bath, and bedtime, right? I'm not staying present in that moment either. And so learning how to practice this presence and this patience throughout life slows down life, and it helps us be more present in our lives. The idea of having a beginner's mind, which I don't know about y'all, I find incredibly difficult, but being willing to see everything that we have as the first time. I think about, as we were preparing for this, something that Aiden said. She said, oh yeah, like when I think about like going and seeing that client that I've seen multiple times before, and I go, oh, I know what's going to be said, or I think I know how this interaction is going to go. That is absolutely the opposite of a beginner's mind. And I think we are all can be guilty of that. So learning to enter experiences, interpersonal communications, your lunch hour, or the next time you go out of here and you go do something like driving your car home, as if it's the first time you've ever done it. Learning to trust ourselves. Trust is a very difficult thing for us to learn, but learning to trust ourselves, learning that our body will breathe on its own. We don't have to worry about that. Our organs work. We can learn to trust what we see and hear, our own wisdom, our own inner experience. If we can't trust our own inner experience and our own wisdom, it becomes very difficult to trust others. Concept of non-striving, which I think is foreign to us, especially as professionals, but this idea of not being focused on a goal. I think early on when I was learning about mindfulness and I was learning about meditation, I always had a goal in mind. The goal was either to block thoughts or to not think about things or to accomplish something. And that is actually the antithesis of mindfulness. This idea of non-striving is learning to be present with the unfolding of life without an agenda. Acceptance, which is a very active process. I think many times in my experience, people look at acceptance as a passive experience. So accepting things for what they are, it doesn't mean that we can't change things, but learning to accept that using this attitude is what will really free us from suffering. Things like pain, sickness, or illness, when things are not going in life the way we want them to, it becomes very difficult to cultivate this attitude of acceptance. Learning to let go, which is the opposite of clinging to things or pushing things away. But it's this concept of not forcing things, not striving, just allowing things to be as they are. So it's about learning to let go of our own desire for things to go in a certain way in life. And gratitude. I don't know about y'all, but I think many times I have caught myself taking just the experience of being alive for granted. Having a job, getting to go to the park or do things with my child, um, coming home to my loved one, and just sort of, not having gratitude for them. And finally, this idea of generosity, which is giving our time and our attention and thought to another person. So I'd like everyone to take a moment and to write down, take a couple of minutes here, and write down some things that you notice that you're grateful for in this moment, in an effort to sort of cultivate an attitude of gratitude. So take a few moments and write down some things that you notice that you can come to mind that maybe you hadn't thought about prior to this moment that you're grateful for. So friends, your job, the fact that you're alive. Yeah. Yeah, I see lots of things showing up in the chat about what you're grateful for. What was this experience like without necessarily the content of the gratitude, but what was it like for you to just take this moment and think about what it is that you feel grateful for? Refreshing, a happy moment, putting aside some stuff, a change of focus, quiet. We're going to hear quiet a lot, I think, today. Some happiness, joy to think about things, peacefulness, redirecting your mind, shifting your perspective. I love that. I like that phrase. Yeah, I think a recognition of the blessings that you take for granted on a daily basis. Absolutely. Part of mindfulness is this idea that we're shifting our perspective in our life, that we're starting to become more focused about our experience. And in Western culture, this is something we're not very used to. Joy, I love that. So along with the 9 attitudes, there's some basic building blocks of mindfulness, right? And so these 3 kind of building blocks are intention, attention, and attitude. So the intention in mindfulness is the why of the practice. It's your own personal vision about what you're hoping to accomplish through your practice. So the intention is the why you're doing the practice. If you're doing mindfulness or if you're doing a mindfulness meditation, it might be, and we'll talk about some of these things as we go a little further, but it could be more about increasing your compassion for yourself, your loved ones, or your clients. You might be looking to lower your blood pressure or manage pain or reduce stress or to reduce intense emotions. But there's a lot of evidence that suggests that intention, what you choose, has a lot to do with your success and your ability to be mindful. Attention has to be is about noticing your internal and external experience and suspending your interpretation of the experience and instead attending to the experience as it presents itself. An attitude is really important. I love this. If you get a chance to read this article by Shapiro, I found it incredibly insightful. But the attitude to which you bring to your practice is what you cultivate. So if you bring an attitude of warmth, kindness, patience, compassion, a non-striving attitude, to your own mindfulness practice, then that is what you're going to develop. If you bring a more judgmental approach to the practice, one that's more of a task-driven approach, then that is actually what you're going to develop. And the goal in this is to really bring the more warm, kind, compassionate, non-striving practice. And I think this is kind of a big thing for us, but the difference between a being and a doing mind. And I think we're all very familiar with the doing mind, right? The doing mind has goals. It's about achieving things. It could be about problem solving. It could be about planning. It could be about noticing you're feeling sad and not wanting to feel sad and trying to problem solve ways of not feeling sad. Whereas being mind is about awareness, an awareness of what your experience is without judging your experience and without necessarily trying to change your experience. It's more about curiosity about your mind, your mood, an acceptance of what is happening in the moment and being present in the moment. So instead of saying, wow, I'm sad, I don't want to feel this way, I'm going to try and change it, which many times actually increases sadness. It's about noticing sadness and kind of wondering about sadness and being curious about the sadness and where you feel the sadness. So I hope everybody has at least enough understanding of, and again, this is not, I'm not able to, mindfulness is a practice that one develops throughout a lifetime. But we're going to go ahead and try and do a breathing space mindfulness activity here, which I know everyone's very busy. I know we all have very stressful careers. Sometimes I've learned that between my sessions, I do not have a lot of time, or between classes, I don't have a lot of time to be able to do a long-term meditation. So as I kind of said earlier, I don't need to tell you, you're all very aware that we deal with a lot of stress in our jobs. We have very demanding roles, whether you're a nurse or pharmacist, whether you're a social worker or some other kind of mental health professional. Many times we take on way more than we can handle. That could mean adding another person to your caseload, taking on a project, having to resolve a conflict that's going on. And so, there's the whole purpose behind MBSR was to try and help people with managing stress. So, learning how to cultivate this idea of mindfulness into your daily life can help with burnout prevention and managing stress. Mindfulness directly involves both consciousness and attention. Mindfulness is giving direction to awareness. When awareness is directed outwards, we tend to attach to the world instead of learning to just sort of be in the world. There's some research that suggests that the practice of mindfulness at work can actually promote employee well-being. It's amongst other things. We have enhanced employee relationships. I think in the articles I was looking at, one of the things that I really found very important to this training in particular, especially with the professionals we're working with, is this bottom one. In a study, Farb, Anderson, and Siegel in 2012, the mindful brain and emotion regulation and mood disorders found that for patients with affective disorders, mindfulness training acts as an alternative to learning to control their emotions cognitively. So it's about learning to direct attention inwards and monitor fluctuations, taking time, and their momentary experience. It reduces our automatic negative self-evaluation and increases our tolerance of negative emotions, pain, and it helps us with developing self-compassion and empathy. And I know that when we burn out, when we become overstressed, I don't know about y'all, but I notice that my own self-compassion will reduce. I notice I have less compassion for my clients, less empathy for the people in my life. So, some additional science behind the use of this, but we know that through MRI images, that there are some changes that occur for people's brain matter. We know that in a study, there are multiple studies that have shown increases in gray matter concentration in certain areas of the brain when people have a regular mindfulness practice. We know that people experience reduced anxiety and depression. They have better sleep, lower blood pressure. They have more increase in pain tolerance. There's reduced binge eating and emotional eating. Much of that's because you're very aware of what's going on. Improved mood because you learn to detach from your thinking and treating your thinking as if it's reality. There's also some evidence that developing a mindfulness practice helps with relapse and substance use disorders. It's not gonna, it won't stop at 100%, but we know that stress is many times something that can cause relapse. And so developing a mindfulness practice helps with reducing the risk of relapse. To professionals, we have reduced stress and burnout. We have less interpersonal conflict with our clients, coworkers, family members, and loved ones. Our own reduced depression, anxiety, and anger, increased well-being, improved health. Healthcare providers exposed to mindfulness-based interventions. This was a study done in 2005. So this is healthcare providers. So this would be nurses, doctors, pharmacy. Healthcare providers exposed to mindfulness-based interventions reported reduced perceived job stress, distress on the job, and burnout. There's scores on measures of negative mood states and psychological symptoms such as exhaustion, anger, depression, anxiety, and tension were reduced. And they actually reported increased ratings of well-being, self-acceptance, self-compassion, empathy, and life satisfaction. Providers of mental health services. So here are LPCs, our family and marital therapists, our social workers, our psychologists. Providers of mental health services exposed to mindfulness-based interventions reported decreases in stress, anxiety, rumination, and overall negative emotions. And following participation in mindfulness-based interventions, individuals reported increases in feelings of calmness, self-compassion, positive emotions, and improvement in overall physical and mental health. So there's a lot of evidence out there that that even learning in rather naive ways, learning how to use these practices will benefit us as professionals, and it will also benefit our clients. So the awareness that emerges through learning to pay attention to the present moment non-judgmentally helps us with dialing down our response to stress. We are more aware of it. So we find that mindfulness influences different parts of our brain, which changes the brain structure and activity in certain regions that directly correlate with attention and emotion regulation. It helps us to react less to stress and less to negative thoughts about ourselves and our world. So there are some mindfulness-based interventions, that exist, and these are just some of the ones that we kind of came across that are all based on mindfulness. So there's MBSR, which, as I said earlier, Jon Kabat-Zinn was the founder of, and that's mindfulness-based stress reduction. There's mindfulness-based cognitive therapy, or MBCT, mindfulness-based passion, acceptance and commitment therapy, DBT, which is something that I've worked with for years, and a mindfulness-based relationship enhancement. I mentioned a moment ago that there are some different types of mindfulness practices. There's formal mindfulness practices, right? Formal mindfulness practices when you're purposefully scheduling time in the day to practice mindfulness, such as noticing an awareness of a certain object, like your breath, or like this body scan. These typically last 5 to 40 minutes. Informal mindfulness is daily activities when you intentionally attempt to bring your mindful attention to the moment. So it's not actually intentionally scheduling time. You're kind of practicing more organically. So these are things like, formal mindfulness practices could be things like meditations, sitting, standing, lying down, walking meditation, or a breathing mindfulness practice, which we did earlier, or a body scan, which we just did, yoga, qigong. And then the more informal ones are things like washing the dishes or driving or going for a walk on your break and just being aware of the walk and not allowing your brain to just run, run, run. I think I go for several walks on the beautiful USC campus that we have here. I feel very fortunate I can walk out my building, and I have a little route that I like to walk. And many times I'll be out walking and I'll be thinking about what I just was doing or what the next thing I need to do is, and that isn't being mindful. Being mindful in this case would be noticing my environment, being aware of the walk, being aware of the fact that my mind is thinking about what's the next thing I need to do and bringing it back to the experience of going for a walk. With practice, you can help with the returning of the mind and the mind staying still for longer and longer periods of time. Again, these kinds of guided meditations and other types of meditations help with the ability to be more mindful throughout the day. They're almost like the workout that allows us to stay in shape. So some more informal practices that you can use throughout your life. When you're driving, when you're in the shower, just noticing the shower. I think as I was writing this, I was thinking about how when I get in the shower, many times my brain is just running, 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 running about where I'm going to be and what my day is going to look like. But just learning how to bring your attention back to the sound of the water, the smell of the soap you're using, the feeling of the water on your skin. Based on what we've presented today, how has your understanding of mindfulness changed? Based on what we've discussed today or what we've presented today, how has your idea and understanding of mindfulness changed?
That the goal of mindfulness is not relaxation.
Yeah, that the goal is being aware of your experience, maybe that it's not too relaxed.
I think that learning that you can do it in an unstructured way. It doesn't have to be so structured or focused to have a good outcome.
You're referring kind of to the informal mindfulness, reinforcing the benefits, didn't realize it was okay for your mind to drift. Being aware of your judgments, but not judging the judgments or judging that you have them. Not judging yourself for not staying focused either. Yeah, isn't that freeing just to know that you can have distractions and bring your attention back, not to force it, just to be present. Learning some of the terms, making the time, and yeah, how short period of time can be useful. That was my big hope for today. And again, it's about connecting with yourself and connecting with your truth and your reality and your life. And the beauty of mindfulness is, as human beings, we all have this ability. We don't take the time to cultivate it. And that's where some of these more formal and guided meditation practices come in, is the ability to cultivate the ability to connect with ourselves. But we all have this ability. We can practice anytime, absolutely. So as you think about those 9 attitudes, is there one that you think that might be more challenging for you, that you might be able to start learning to try and practice and incorporate more in your daily life? Obviously, as humans, we love to practice the things we're good at. Non-striving, yes. Patience and acceptance. Yes. How about other people? Non-striving and patience and acceptance. Love it. Yes. Learning to let go. Sure. Acceptance. Being non-judgmental. Non-striving. Gratitude. Yeah. I think this idea of non-striving has been a big one I've been practicing the last couple of weeks as I've been getting ready for this, because I realize I'm very goal-oriented. I have a toddler at home that's learning to ride his bike, and I can't wait till he gets on a pedal bike so that we can go more places. But he's on a balance bike right now, and so just learning how to be present with him. These are some mindfulness resources. You can go to UC San Diego. They've got some resources. There's the Center for Mindfulness Studies in Canada. Oxford University has a bunch of information, and so does the Insight Meditation Society. These are a couple of mindfulness apps. They're free. I think you can get a paid version if you want as well, but these are some that were rated highly in 2024 and are free. And I think that's about it.